invite the chairperson, Dr. Renuka T. Ma'am, assistant, principal, Nursing College, AIMS Gorakhpur, co-chairperson, Dr. Devika T. Ma'am, assistant professor, AIMS Gorakhpur, moderator, Mrs. P.R. Ligo Shinsi Ma'am, assistant professor, Guru Shri Gorakshnath College of Nursing, rapporteur, Ms. Shivangi Ma'am, clinical instructor, Guru Shri Gorakshnath College of Nursing, and technical expert, Mr. Prabhu sir and Mr. Akshay Edward sir. Now, I would like to invite our moderator for this session, Mrs. P.R. Ligo Shinchi ma'am, for the further proceedings of the technical session 2.
Our nurses, our future. Combine will shine the light on nurses on a brighter future. I want to be a nurse because I have always been passionate about helping others. No matter how difficult the days may get, don't forget the reason you become a nurse. Myself, Ligo Shinsi, Assistant Professor of Guru Sri Gorakshnath College of Nursing, Gorakhpur. Excellencies, distinguished chairperson, co-chairperson, participants, and my dear students, a very happy good afternoon to you all. We are indeed delighted to welcome you all for the first day of International Conference on 12th Feb 2024. The theme is Indian Knowledge System, a boon for future nursing services. At this instant, I would like to thank the management, Registrar Sir, Vice Chancellor Sir, and our beloved Principal, Dr. D.S. Ajita Ma'am, for organizing this conference, which provides an opportunity for experts to share their thoughts and insights for the future of nursing services and education. It's great honor to have a chairperson, Dr. Renuka Ma'am, Principal of AIMS College of Nursing, Gorakhpur, Uttar Pradesh. Welcome you, ma'am. Next, I would like to honor to have a co-chairperson, Dr. Devika Ma'am, Assistant Professor, AIMS College of Nursing, Gorakhpur, Uttar Pradesh. Welcome you, ma'am. I also extend my heartiest welcome to the delegates, paper presenter of various colleges and hospital. I extend my thanks to the authorities and the principals of institution for deputing their staff. Next, it's a time to introduce my rapporteur, Ms. Shivangi, clinical instructor and technical experts, Mr. Prabhu and Mr. Akshay Edward, to gather with this team to complete the session successfully. Now, let's start with the intelligent session of Future of Nursing Services and Education. Future of Nursing Services and Education. The future of nursing in India hold the provinces of innovation, specialization, leadership, etc. The future of healthy Indian relies on the strengthening on care quality, laying more emphasis on nursing education, creating favorable policies, improving in nursing services, and charting bright career for the healthcare provider. The first session will be deal by paper presentation. Now I call upon Ms. Shalu Jaiswal for the presentation. She is a first batch student of our college. Now she is working as a clinical instructor in Government College of Nursing at Basti.
Good afternoon, respected Principal Ma'am, Dr. Renuka Ma'am, and Dr. Devika Ma'am. And I thank the organizing committee for giving me a chance to stand here and do the paper presentation in front of you all. So myself, Ms. Shalu Jaiswal, I'm working as a nursing tutor in College of Nursing, MVSMC, Basti. The statement of the problem was a study to assess the effectiveness of information education and communication module regarding catheter-associated urinary tract infection among staff nurses working at BRD Medical College, Gorakhpur. So according to Florence Nightingale, it may seem a strange principle to enunciate as the very first requirement in a hospital that it should do the sick no harm. So according to Maslow, as we all know, the basic physiological needs are oxygenation, nutrition, elimination, rest, and comfort. So among the physiological need, urinary elimination is the one, and this only emphasizes the importance of kidneys in our life. So we all know that catheter-associated urinary tract infection, it produces morbidity in the hospitalized patients.
and the incidence of catheter-associated urinary tract infection is directly proportional to the number of catheter days. The most important preventive measure for decreasing the incidence of catheter-associated urinary tract infection is limiting the use of catheters. This is possible only if the staff nurses had adequate knowledge regarding the appropriate indication for inserting urinary catheters. According to Center for Disease Control and Prevention, they have recommended that educating healthcare workers regarding infection control measures is the highest priority to prevent and control hospital-acquired infection. And American Nurses Associations, they have revealed that catheter-associated urinary tract infection are the most commonly reported hospital-acquired conditions, and the rates are continuously rising. Next, we will move on to the need and significance of study. We all know that urinary tract infections are the most nosocomial infections that account for 20 to 40% of all hospital acquired infections, and 80% of these urinary catheters are because of use of catheters. Most of these studies advise that between 10 to 30% of patients with short-term catheter will develop bacteriuria, presence of bacteria in urine. The most common hospital-acquired infection is catheter-associated urinary tract infection, accounting for almost 40% of all the nosocomial infections. Foley's catheter are used very frequently in hospitalized patients, and almost 25% of them undergo catheterization during their stay in the hospitals. We know that nurses are the primary managers of all the routine care and problem solving associated with patients who have urinary catheters. So therefore, educating staff nurses regarding catheter-associated urinary tract infection will help prevent catheter-associated urinary tract infection, as they could remind the staff nurses for aseptic insertion, catheter care, and removing catheters as soon as the indication for catheterization ends. Keeping in view the above needs and importance of empowering the nurses with knowledge, the researcher felt the urge for preparing the teaching module for staff nurses who are caring for the clients with urinary catheter after eliciting their current knowledge. The objective of this study was to assess the pre-test level of knowledge regarding catheter-associated urinary tract infection. Second objective was to assess the post-test level of knowledge regarding catheter-associated urinary tract infection among samples. Third was to compare the pre-test and post-test level of knowledge regarding catheter-associated to compare the pre-test and post-test level of knowledge regarding catheter-associated urinary tract infections among sample. Fourth was to analyze the effectiveness of information education and communication module regarding catheter-associated urinary tract infection. And last was to find out the association between the pre-test level of knowledge score with the selected demographic variable. So again, review of literature was done under two headings. First was the studies related to catheter care, and second was studies related to catheter associated urinary tract infection. So Ravindra H. et al. Conducted a study to assess the effectiveness of structured teaching program on knowledge and practice regarding urinary catheter care. A quantitative research approach with pre-experimental one-group pre-test design was used. Non-probability convenience sampling technique was used to collect 90 samples. A structured questionnaire and practice checklist was prepared to assess the knowledge and practice of staff nurses, and the data was analyzed by SSP version 2.1, and the result showed that 51 staff nurses were having inadequate practice and 39 were having adequate practice. Next, we will move on to the methodology. So quantitative research approach was used in this study. One group pre-test, post-test research design was used in this study. The independent variable was information education communication module on catheter-associated urinary tract infection. The dependent variable was level of knowledge. The study setting was conducted at BRD Medical College, Gorakhpur. The population for the present study was comprised of staff nurses working at BRD Medical College, Gorakhpur. The sample for the present study were selected staff nurses who fulfilled the inclusion criteria working at BRD Medical College, Gorakhpur. The sample size was 30 staff nurses who were working at BRD Medical College were the samples. Non-probability convenient sampling technique was used to select the sample for the study. Next, we will see the inclusion criteria. So we included the staff nurses who worked at BRD Medical College, Gorakhpur. So staff nurses who were present at the time of data collection, they were selected. And staff nurses who were qualified as BSc Nursing or General Nursing and Midwifery or Post-Basic BSc Nursing or MSc Nursing. The exclusion criteria were student nurses, staff nurses who are not available during data collection period, and staff nurses with less than 1 year of experience. Next, we will see the data analysis. So in pre-test level of knowledge, we saw that 6.7% of staff nurses were having excellent knowledge, 3.3% of staff nurses had good knowledge, 50% of the staff nurses were having satisfactory knowledge, and 40% of the staff nurses had poor knowledge regarding catheter-associated urinary tract infection. So after the post test, we analyzed that 20% of the staff nurses had excellent knowledge, 70% of the staff nurses were having good knowledge, and 10% of the staff nurses had satisfactory knowledge regarding catheter associated urinary tract infection. So next we will see the effectiveness of information education communication module. So the pre-test mean is 11.83 and the post-test mean was 18.5. The standard deviation was 3.41 and 3.89 respectively. At 29 degree of freedom, the calculated t-value was 16.22, which is like more than table t-value. So we can conclude that the administration of information education communication module to the staff nurses was effective to enhance the knowledge regarding catheter-associated urinary tract infection. So for association, I used chi-squared test to identify the association between the pretest level of knowledge with the selected demographical variable. The calculated chi-square value of the demographic variable was more than the table value. So it was concluded that there was significant association between pretest level of knowledge with the selected demographic variable. The variables were gender, year of experience, educational qualification of the staff nurses, and present placement in wards. The results. Among 30 samples, 27% were in the age group between 21 to 30 years, 46% were between 31 to 40 years, 27% were between 41 to 50 years, 100% of the staff nurses were female, 40% had experience between 1 to 5 years, 50% had 6 to 10 years of experience, and 10% of the staff nurses were having experience of more than 10 years. So 100% of the staff nurses were qualified in general nursing and midwifery. 30% were posted in intensive care unit. 40% of the staff nurses were posted in medical unit, and 30% of the staff nurses were posted in surgical unit. In pre-test, 6.7% of these samples, as we already have seen, they were having excellent knowledge. 3.3% were having good knowledge, 50% were having satisfactory knowledge, and 40% were having poor knowledge. So after the post-test, 70% of the samples were having good knowledge after administration of information education and communication module regarding catheter-associated urinary tract infection. So we also had some limitations. The first limitation was the size of the sample was too small to make broad generalization. The prescribed data collection period was only 1 week. The care given by the staff nurses were influenced by the factors such as understaffing, lack of time, and due to lack of supply, even though it is less likely. This study was limited only to the registered staff nurses working in the selected hospital at Gorakhpur. So after the limitations, we can say that we can use more like size of the sample can be increased and data collection period also can be enhanced. So recommendations after the study were a similar study on larger sample for longer time can be replicated for broader generalization if we want. A descriptive study can be used for specific factors which can hinder the nurse's practice in prevention of catheter-associated urinary tract infection. By using quasi-experimental study, the information education communication module prepared can be tested and guidelines can be charted out to assist the staff nurses in preventing catheter-associated urinary tract infections. So concluding this study was aimed to assess the effectiveness of information education and communication module regarding catheter-associated urinary tract infection among the staff nurses. We found out that the knowledge of the staff nurses was improved after administration, and hence the IECM was found to be effective in improving the level of knowledge. Thank you, ma'am.
Very good try. Congratulations,
Thank you so much.
Shalu. Is this your fourth year study?
Yes,
Research
ma'am.
study that you have published?
ma'am.
Good. The thought of coming to alumni, alma mater and doing as alumni, really feeling proud, na?
Yes.
Yes. Congratulations once again.
Thank you.
So, my doubt is, what were the components in IEC?
Ma'am?
IEC module you made, now what
yes.
were the components?
Ma'am, we prepared the lesson plan, and after that we prepared the
Components in the lesson plan.
components were like the indications for catheter, like what are the indications, and then only we will like implement the catheter on the patients, and after that, after the specific period of time only, we will remove the catheter if the indications for the use ends. So this was the component, and after that we will check for the complications of the patients, and we will enhance the level of knowledge regarding the catheter associated urinary tract infections.
Care bundles, any of the care bundles you bear the component in your COTI?
No. Catheter care bundle.
Care bundle you had? Yes, standard NABH or what? Which care bundle you had?
Ma'am, at that time catheter care bundle was there, so like we used in the information, like lesson plan we used that.
Right. Don't get panic. Okay, just I'm asking. So, why you chose staff nurses with less than 1 year excluded from the study?
Because ma'am, they are the new, and like they are working for a specific period of time, and like for broader we had to make some generalizations. So I used staff nurses who are having more year of experience, because they will be the one who know that how much amount of like complications are present in the ward for a longer duration of time as compared to the new nurses.
Senior nurses already they know about it, na? So, is it why you confirm made your point that new nurses need not be taught? The new nurses, already old senior nurses will have experience, they can prevent, isn't it? The new nurses, they may be learning in a learning period to bring out the changes, right? So in that case, why
No,
you?
actually, why? Because the new nurses already like they are having like less experience in the ward. The information education communication module was regarding prevention of catheter associated urinary tract infection. So for preventing that, staff nurses who are having more year of knowledge, so they will be like they will be having more knowledge regarding the prevalence rate in the ward. So that is why I said.
If you say that new senior nurses are there all over the hospital, that them only they can prevent, means by the time they could have prevented, na? Percentage of COTI should not be there, na? Yes?
Yes, ma'am.
Yes, it's your perception, right? I'm just asking why you want it. So they need to be educated so that the development can take place. When already been with knowledge, and if they would have already prevented, then why COTI is there?
Yes.
So that means somewhere lagging in the experienced people also, right? According to you also, I'm telling. Though after your post test, though you have taught your COTI IEC module, 20% percentage people only got excellent score. 70% got good score. Why 100% people cannot get when the seniors you targeted taught them, already known how to prevent? So what do you feel where you lacked to bring that 20% only as excellent?
Their initiation, how much they were initiating at that time. So if like we all are initiating to study regarding the care which we are providing to the patient, so we have to initiate to provide proper care to the patient. So at that time, I think proper initiation from both sides, from my also as well as the staff nurses, were lacked. So because of that only, there was significant like 20% deprivation was there.
Which you could make them to be 100% excellent in future studies, right?
Yes, I'm
Hopefully.
sure.
Last question is, what was the lesson you learned from this research?
I learned that first of all, we should provide specific care to the patients when we are like working in the ward. 100% of dedication should be there because catheter associated UTI is hospital acquired infection. It is not which a patient is bringing from the home. So we have to prevent all the complications which a patient is getting in the hospital. No other like complications should occur when a patient is there like admitted in the hospital. This I learned.
Fine. Congratulations once again.
Thank you, ma'am.
Hi, I have three questions. Hi, Miss Shanu.
Yes, ma'am.
Well presented.
Thank you,
I
ma'am.
have three questions only. Okay. So, what is any? Do you have any statistics related regarding UTI in BRD hospital? What made you to select this topic?
Ma'am, actually, the pilot study was conducted at Guru Shri Gorakshnath.
No, before pilot study, when you are selecting the topic, you may be having some background behind this topic. No.
More number of staff nurses were present in the BRD Medical College as compared to the other hospitals which are present in Gorakhpur.
No, topic.
Catheter associated UTI.
Yeah. So, you have any statistics of UTI infections in BRD hospital? Do you have any statistics?
No, ma'am.
No. Okay. So, if you go with that, so there will be a good outcome with your research study. Okay. So, why don't you use this control group?
Ma'am, because the staff nurses who are present at the time of data collection. So if we are using control group only, so chances of like a shift of wards will shift of timing will be there. So that is why I did not use the control group in this study.
If you have a more number of samples, so I think with the control group, you can control these 16 years variables.
Okay.
So that will be the best option. Then may I know how you recruited the sample for your research study?
Ma'am, based on the inclusion criteria,
Okay.
5 inclusion criteria was there. So based on that only, who the staff nurses who fulfilled the inclusion criteria. So based on that only, I selected.
Okay. Good.
Thank you so much, ma'am.
After your study, did you recommend anything to hospital where you did your research?
No, ma'am. Recommended in dissertation. Ma'am.
Recommended?
In dissertation.
Not in thesis. Somebody has to be get benefited. That recommendation you are supposed to inform, and that report you are supposed to give to hospital where you did a. So do that.
Okay, ma'am.
Thank you.
Thank you so much, ma'am.
Thank you for the presentation, Ms. Shalu. Now I invite Ms. Kajal Maurya for the presentation. She is working as a clinical instructor in Guru Sri Gorakshnath College of Nursing.
Good afternoon, respected ma'am, Dr. Alka Saxena ma'am, and Renuka ma'am, and principal ma'am, and dear students. My name Kajal Maurya. I am working in Guru Sri Gorakshnath College of Nursing as a clinical instructor. First is a statement of the problem. A study to assess the level of the knowledge and practice regarding home infestation among the mother of the toddlers at Balapar village, Gorakhpur. Introduction. Children are the wealth of the tomorrow. Take care of them if wish to have a strong India. It is this line given for the according to the Jawaharlal Nehru, and the children constitute a large section of the population in India. It has been a great challenge to the nation to provide health, education, and food. The children below 12 years school age population comprises of 38% of the country who are the dependent unproductive but has a great potential. Need of the significance of the study. K. Park conducted a study during 2007 state that worm infestation mostly occur in the children who are in the age group 1 to 4 years. Toddlers are vulnerable or special risk group in the population deserving a special care for special care. It is seen that the rural public were using open field application and the community was not mentioned in proper environmental sanitation. The people walk with wear food and not practice the hygienic measures like washing hands before and after defecation, wear sleepers, drinking safe water and using latrines facilities. It has it has seen in many toddlers with worm infestation. The toddlers were often suffer with the abdominal pain, vomiting, and diarrhea. Thus these children were not able to maintain their normal routine life. The toddlers' health must be promoted and product protected to again good citizen. The mothers play the major role promoting the health of the toddler. The mother is the first person to rear and supervise the children grow pattern from birth. The mother acts as a military man to maintain the monitor her children growth and development, nutrition and health patterns. Next, objective of the study. To assess the level of the knowledge regarding worm infestation among samples. Second objective, to assess the practice regarding worm infestation among samples. Third objective is to find out association between the level of the knowledge regarding worm infestation among the mother with the selected demographic variables. Research methodology. Research approach. In this study, quantitative research approach was used. Research design. In this study, descriptive research design was used. Research setting. In this study, the research conducted in Balapar village, which situated in Gorakhpur, Uttar Pradesh. The distance of the Balapar from Guru Sri Gorakshnath College of Nursing is 1.1 kilometers. The total population of the Balapar village is 3,161. Population. In this study, the population consists of the mothers of the toddlers in Balapar village.
Sampling and sampling techniques. Samples. In this study, the sample consists of the mothers of the toddler. Sample size. In this study, sampling technique, a sample size consists of the 60 mothers of the toddler. Sampling technique. In this study, convenient sampling technique was used. Sampling criteria, inclusion criteria, mother mothers who are having toddlers, mothers who are available at the time of the data collection, mothers who are willing to participate in this study, mothers who are able to the read, write, understand either Hindi, English, understand local language, Bhojpuri. Description of the tool. The tool consists of the three sections. Section A, social demographic variables. It includes the items of the selected demographic characteristics of the mothers of age, religion, education, types of family, occupation, family income, source of information, sources of water, and section B, self-structure knowledge questionnaire. It is include 25 multiple choice questions for the knowledge regarding worm infestation. Each correct answer is given score a 1 mark and wrong answer or unanswered was given score 0. The maximum score is 25 is interpreted level of the knowledge. The score were distributed as follow. Adequate knowledge 17 to 25. Results. The level of the for result the level of the knowledge among sample 25 samples had adequate knowledge regarding worm infestation. 15 samples, 28.33% samples had moderate knowledge regarding worm infestation. 17 samples and 46.67% sample had inadequate knowledge regarding worm infestation. Frequency 28 sample had poor knowledge regarding worm infestation. Worm infestation practice among the mothers of the toddlers. Practice who are having poor knowledge 32 frequency is 32 and percentage is 53.33 percentage. Fair knowledge, fair practice 18 frequency and 30 percentage. Who are having good knowledge, good practice 10%, 10 people and 16.67 percentage. Table show that 16.67% sample had good practice, 30% of sample had average practice, 53.33% had sample poor practices. Association between level of the knowledge with demographic variables. First, it is a consist of the 8 questions. Socio-demographic variables. First is age, chi-square is calculated 5.6785, degree of freedom 6, and p-value 12.59. It is a non-inference, is non-significance. Second, religion 1.3102, degree of freedom 6, and the p-value 12.59. It is a inference is non-significant. Third, education status 7 chi-square is 7.4218 and degree of freedom 6, p-value 12.59. It is a inference is non-significant. Fourth, type of the family 9.5276, degree of freedom 6, and p-value 5.99. Its inference is significant. Sixth is incomes 8.6911, degree of freedom 6, and p value 12.59. It is non-significant. 7. Source of information 14.3771, and degree of freedom 6, p value 12.59, and inference is significant. And 8. Source of the water 5.99, and degree of freedom 6, p-value 12.59, and inference is non-significant. Chi-square was calculated to find out association between the knowledge score with their selective demographic variable. Significant association was found below knowledge score of the mothers of the toddler regarding worm infestation with socio-demographic variables such as types of family and source of the information at level of p-value less than 0.05. No significant association was found between the knowledge score of sample among mothers of the toddlers with their demographic variables such as religion, education, educational status, occupation, incomes, and source of water. Conclusion. The investigation of the study focused a study to assess the level of the knowledge practice regarding worm infestation among the mothers of the toddlers in Balapur village at Gorakhpur. The conceptual framework adapted for the study was based on modified Rosen-Torch model 1974 and health belief model 1978, which which is described the conceiving of the desired situation and way to attain it. The research design was used in this study. Described research design was non-probability convenient sampling technique was adapted to select the sample according to the inclusion criteria. Data collection was done by the self-structure questionnaire to assess the level of the knowledge of the samples. Thank you, ma'am. Ma'am, any questions?
So you have taken a very good topic, worm infestation. Before that, I would like to congratulate you for taking a step forward to present your BSc research. This is your BSc research?
Yes.
Yes. Very good. You are interested in research. Coming forward is one big move, isn't it? Congratulations for it.
Thank you, ma'am.
The topic is worm infestation, like which leads to anemia. That
Yes,
too in the toddler. Like it gives a big disturbance in the health of the
Yes.
total family system, right? So you have said here type of family and then the source of information has got a significant role in this knowledge. Can you explain that, like how it have the association?
Yes, ma'am. Ma'am, types of family, it means who are belong to the below poverty line, have less knowledge regarding worm infestation, like children is walking without sleepers in swell. This is factor may lead to the worm infestation in children.
Or type of family?
Ma'am, types of family in category below poverty line.
That is economic status, na? Type of family is joint family, nuclear
Yes,
family.
ma'am.
Which
Ma'am,
was affected?
Ma'am, mainly nuclear family, ma'am. It is affected.
Why? Nuclear family only 3 or 4, so they will be concentrating, pampering the toddler. How come nuclear family will get associated with the the worm infestation. Affordability is more na in the nuclear family. They will have slippers, foot, barefoot walking will not be there. They'll be taking care of the child, nutritious food, all that. How, what type of association then this type of family had? Okay, source of information like.
And source of information mainly in community area. Many people were not aware regarding worm infestation and causes of the worm infestation. And that is a main source of information. Less information regarding worm infestation, how to spread. That is a main cause of main.
They were
reason
not
of the,
aware of it.
yes,
Majority. Fine. Now, what is your future plan? Now you said that poor knowledge is 53%.
yes,
What is your future plan?
Future knowledge in source of the information increase through the television channel ads and other we are going to the posting regarding community health nursing. That time we are educate the people who are having less knowledge or regarding home infection, who are having toddlers, mainly having toddlers, explain that regarding home infestation.
That Balapur village, again you will go and have take up that role.
Ma'am, we are not go. Ma'am, like a student are go for the community posting. That time.
That's what I'm asking. Along with the students,
Yes,
you
ma'am.
will focus on the people who
Yes,
were
ma'am.
having poor knowledge.
Yes.
Good. All the best.
Thank you, ma'am.
Congratulations, Kajal.
Thank you, ma'am.
How did you assess the practice of worm infestations
Then,
among the men?
in this research, we are using one checklist. This checklist is according to the practices food was kept with clothes and who are follow the walk the children with sleeper. That type of question we are prepare in checklist form.
Which standardized one?
Yes, ma'am.
Okay.
Thank you, ma'am.
Congratulations. I'm Dr. Alka Saxena, Principal BRD Medical Nursing College. I would like to ask, have you prepared some pamphlet to educate the person?
No, ma'am. That time we are not prepared for pamphlet.
Whenever anyone is doing some knowledge assessment or practices, you should have some you have to give output by assessing the knowledge and practice. Not in hall it is important, no? You have to make some pamphlet, some booklet, some module, so that will be useful further. Okay, thank you.
When we are given knowledge who are
Then you have the prepare the lesson plan according to
ma'am.
that you have given.
Yes,
No?
ma'am.
So you can make 2 page or 1 page pamphlet, like the information you have to do in that little pamphlet, and then you can distribute it to that. So it will be more useful.
Yes, ma'am.
Okay, thank you.
Thank you, ma'am.
Thank you for the presentation, Ms. Kajal. Now, I invite Mrs. Soma Rani ma'am, Associate Professor of Guru Shri Gorakshnath College of Nursing, for the presentation.
Good afternoon, Chairperson and Co-Chairperson and my beloved Principal and delegates. I myself, Mrs. Somarani Das, Associate Professor of Shri Gorakhnath College of Nursing, presenting a research project on the study to assess effectiveness of planned teaching program on knowledge regarding alternative system of medicine in mental health care among adults. So now the introduction. The term alternative medicine is generally used to describe practice used independently or in place of conventional medicine. The term complementary medicine is primarily used to describe practice used in conjunction with or to complement conventional medical treatments. The non-pharmacological intervention of alternative medicine can employ mind-body interventions designed to reduce the pain and mood disturbance and increase the quality of life. Patients often express interest in mind-body alternative system because they offer a non-drug approach for treating rather than medical treatment. Today, numerous systems of medicines continue to coexist with allopathic medicine. Some of alternative medicine which are commonly used in mental disorders are Ayurveda, Unani, Siddha, herbal, homeopathic, acupuncture, yoga, etc. The objectives of the study to assess the pre-test and post-test knowledge regarding alternative system of medicine in mental health care among adults, to, to evaluate the effectiveness of plant teaching program on knowledge regarding alternative system of medicine in mental health care among adults. The third objective is to associate the pre-test knowledge regarding alternative system of medicine in mental health care adults with their selected demographic variables. The research hypothesis 1, there is a significant difference between the pre-test post-test knowledge regarding alternative system of medicine in mental health care. The second hypothesis, there is a significant association between the pre-test knowledge of adult regarding alternative system of medicine in mental health care with their selected demographic variables. Methodology, experimental one group, pre-test and post-test design one adapted for the study. The structured question was prepared and used to collect the data. Sampling technique adopted for the study was non-purpose convenience sampling. The final study was conducted on 60 samples in Sevajpur, Moradabad. The data collected was analyzed by means of descriptive and inferential statistics. The result, so in the pre-test level of knowledge, I've seen that the majority of 93% of adults have inadequate knowledge, and moderate 6% of have moderate knowledge, and 0% have adequate knowledge. In post-test level of knowledge, you see the majority of 60% have adequate knowledge, and 40% have moderate knowledge, and 0% have inadequate knowledge. The effectiveness of structured teaching program. The maximum knowledge scores on general information was 12, acupuncture was 2, acupressure was 4, Ayurveda was 4, the maximum knowledge score on Unani was 2, Siddha 3, homeopathy 4, chiropractic medicine 3. So overall score on knowledge was 34. The overall mean score was 17.34. The pair t-test was carried out to find out the effectiveness of structured teaching program and compare the pre-test and post-test knowledge of alternative system of medicine among adults. So in the pair t-test, the score is 33.58, which is highly significant at the level of probability of less than 0.05% of level. So this shows that pair t-test score shows that research hypothesis is accepted. So there is a significant difference between pre-test and post-test knowledge scores regarding the alternative system of medicine among adults. So this also shows that the pre-test test also shows that there is a effectiveness of structured teaching program. The second hypothesis was the association between the pre-test knowledge score of alternative system of medicine regarding among the adults. So here the association between the knowledge scores. So square test was carried out to find out the association. So in that chi-square shows that there is a significant difference in the association in the knowledge scores of the regarding the alternative system of medicine among adults with their selected demographic variables, only that education and types of family and sources of information. The conclusion, the study concludes that there is a need to assess the knowledge regarding alternative system of medicine and to develop the plan teaching program to improve the knowledge regarding alternative system of medicine in mental health care among rural adults. Thank you, ma'am.
Can you take your pre-test slide?
Pre-test lies is a majority of elderly rural adults says inadequate knowledge. So there is a ma'am one inadequate printing mistake is there, ma'am.
No, as you have shown the effectiveness of STP, na?
Yes, ma'am.
Like the tabular column in the pretest you have, like this? You have in the
I have, ma'am.
You have?
Yes, ma'am.
Let it be, let it be. See here, why very few questions in question maximum score is 34, na? Why Unani 2 question, Ayurveda 4, general information 12. General information, what you kept?
General information regarding what is the benefit of alternative medicine, what is the actual definition of alternative medicine, and what is the meaning of conventional medicine, and what are the types include, and what is the benefit.
Okay, those 12 questions.
Yes, ma'am.
At least you could have had 5 questions in all equally 5 questions
yes,
in the each Ayushka, each
yes,
division.
Yes,
very less question and the effect mean also very less.
Yes,
now, have you observed this?
Yes, sir.
Yes, 2 questions only. In that one only they have scored.
Yes, so more questions. Yes, ma'am.
So how do we say that they have acquainted more knowledge when the mean score is very less? No? Just think of it.
Yes, right? More questions means more, so they can get more knowledge.
No, after your test only, this effectiveness only says this less amount of mean.
Yes, ma'am.
Then what is the effect of your teaching like that? Can you get what I'm telling?
Yes, ma'am.
Yes.
Thank you.
Here.
Good presentation.
Thank you, ma'am.
How you got an interest in alternative medicine?
Because as per my knowledge, I have seen there is a the mental health treatment, the psychiatric medicine and antidepressant drugs they're using, it has lot of side effects. So prevent the side effects, there is a alternative medicine. This the medicine has a lack of side effect. So instead of using that allopathic medicine, so we can use we can educate the people to go for alternative treatment of medicine to treat the mental illness and even the preventive promotive curative aspect of mental health other than having without any side effect like allopathic medicine.
In STP, what are the things you added? What things you taught to them?
Here, ma'am, general information related that alternative system of medicine and related the all acupuncture, acupressure, Ayurveda, Unani, homeopathy medicine, and Siddha. So all these aspects are included there. Their meaning and their purpose and how to prepare the principle and what.
I think in nursing, this alternative medicines not yet added. So slowly, I think in future,
Yes,
these things will be added in our curriculum. So with complete knowledge, if you go into this type of study, so that will be beneficial, I think.
Yes, ma'am. Thank you, ma'am.
Okay.
From audience, anyone have a question? Good questions will get reward. Yes, from audience. 4th year. Out of all presentation. Post BSc. Thank you, ma'am, for the presentation.
Thank you.
Once again, I thank all the research paper presenters for the presentation. Now, I am highly privileged to confer introduction about the chairperson of this session, Dr. Renuka Ma'am, Principal, AIMS College of Nursing, Gorakhpur, Uttar Pradesh. Ma'am has completed UG in 1998, PG in Medical Surgical Nursing in the year of 2003, and a doctorate in 2014. Ma'am started her career as a tutor and promoted as a lecturer, associate professor, principal. At present, she holds the position of principal in AIMS College of Nursing, Gorakhpur. Ma'am has more than 23 years experience in teaching and research. Ma'am has published various scientific articles in national and international journals. She has presented near about 136 publications and served as a resource person at both international and national conferences. Ma'am has organized numerous of workshops and conferences at state and national level. She did 4 funded projects under IMR interdisciplinary project in the year of 2015 and 2018. She has done many other courses such as postgraduate diploma in yoga therapy, MBA in international business, and fellowship in palliative care. She is the author of geriatric nursing textbook, Nursing Care of EAD Patients. Ma'am received many awards. She is a gold medalist in BSc Nursing and state first in Medical Surgical Nursing and MSc Nursing. Ma'am has awarded for Excellent Teacher, Best Service Award, Best Administrator Award, Best Women Award, Best Teaching Award, Best Principal Award. Now, I would like to invite Chairperson Dr. Renuka Ma'am, Principal, AIMS College of Nursing, Gorakhpur, Uttar Pradesh, for the invited talk regarding future of nursing education. Welcome you, ma'am.
Very good afternoon. Gorakshnath, Gorakhnath College of Nursing. I'm not new person. I'm the family member for Dr. Radhita, isn't it? Many have seen me before, very familiar face, isn't it? Yes? Okay. So today we had a theme in the second half of the presentation. In the afternoon, we had future of nursing education and services. So future of nursing education, is that, just I'm throwing a question, is that the same way of nursing education being taught 20 years before is followed same? Followed same? What are the new changes have come? What are the changes have come? Yes? Digital changes, right? Computer assisted changes. Thank you. Computer assisted changes, right? So we are technology. Technology is the biggest cause for becoming a change, making a change in the education and also in the nursing service, right? So this technology plays one important role to have a change in the education and in the service. So we need nurses all across the globe with innovative thought. Yes, innovative thought to treat the complex cases, diseases with new protocols, computer assisted, augmented, virtual reality. So we nurses, nursing students, we need to be prepared to be placed in such a type of global standards, right? Do you think yes or no? When tea will be given? Boring. Huh? Yarning, dreaming, huh? No attention at all. So the focus is mainly when tea snacks will be given. Dr. Adita, when it will be given? After this session. So quickly I will finish. We all will have tea, right? Yes, happy faces for tea. Right? Not for artificial intelligence, not for innovation, not for technology. It is only for tea and coffee, right? Yes. So to go with the global changes, augmented reality, virtual reality, what is going on in abroad. The teaching is not even the simulation lab which they have is not equivalent to the lab which we have. We are now very primitive. We have Dr. Ajita, with all the efforts they have made the simulation lab to be open. Isn't it? Yes. This we have started now. Imagine the incorporation of augmented reality, virtual reality. Virtual reality is what? The how we do 8D, what is that? 8-dimensional play, 5D theaters, 8D theaters. In malls, they have put one goggle, feel that you are there in the roller coaster. Yes or no? That is how the nursing procedures are taught with the virtual reality classes. Yes, that means you have to feel the procedure. How long it will take? You tell me to bring that. Yes, the change may come little late also, but the knowledge of the change should be there, na? For the students to put as means at least the confidence for the students to have whether you can face this sort of changes in the nursing education. ಇದು ಓಡಿ ಓಡಿ ಕೇಕ್ಲಿಲ್ಲ okay fine okay so to overcome see the knowledge of so the knowledge of new changes should be known to the students, yes or no? You go and face it in the global placement, you go and face it, but that time you should not face it with fear. You should say that I know already but I am not into the practice. Knowing already is good than having a fear of focusing, right? Fear of facing, yes or no? So our fingers are crossed. So now the Indian Nursing Council and the universities like your institutions are now keen in teaching with the new innovations. Our educators and administrators' fingers are crossed. What changes I will make in my university? What changes I will make in my students? What changes I will make in my nursing teaching? That is how the administrators and the high level policy makers are thinking, so that you people after training will be the people who place in the global scenarios as nurses, as the global nurses. So the technology plays important role. Digital learning, yes, simulative learning with all these augmentation to know with the just a finger you will get the details of the patients. Telehealth nursing. There are so many challenges there for the new nursing students or new nursing nurses, novice nurses. So their placement in and competition with the global nurses. Yes, how we have to be treated on par with the other global country nursing officers. Yes, do we need to get prepared for that? Do we need to get prepared for that or not? Absolutely right. That is the future of nursing education and future nursing services. Does not as the days we have been doing it. It's all gone. Now the administrators, nursing college principals are thinking for something new. Every area of the education, every area of the specialities of education, every didactic lectures, students are not liking. Yes, I'm speaking. How many of you truly present here? How many of you are mentally here? Why like this? If I feel like this, yes, thank you, girls. So if you say like this, that means you're not here. Yes, how many of you are mentally here? Yes. Even then, some hands are not there. That's fine. Usually, boys are boys, right? Yes, that's fine. So why I'm talking is this: the way we have been prepared, it was gone. The days had been gone. We are now in the competition world of technology. We administrators are even in aims I'm talking about, we are critically thinking how some innovations can be made. Lot of researchers we are taking how to make some innovations in the healthcare devices and palliative care, pain management clinic, what is new. So when we give something new in the service, ultimately nursing students will learn new. After knowing, again they'll be back to the practice. There, the quality patient care will be changed because of the new innovations and technology. Without computer assistance, nothing is moving on nowadays. Yes or no? If somebody read the CV of mine, who will see? If it is put up in the present PowerPoint, yo, this madam has done something. So there we need our computer assistance. Every area we need to have computer assistance nowadays. Without digital move, there is nothing change in nursing education. Yes, we have given so many mandatory modules, right? With the computer assistance and technology, we are through with the mandatory modules. We are thinking that something new to be given. Indian Nursing Council is focusing always to give some new thought of school of thought for the students, how these nurses can be done like the students can be given something new to have a competition with the global nursing students like that, isn't it? So the thought process is full of with technology, innovation, healthcare devices from nursing, for the patient care, for the nursing profession, like that people are thinking. So no more didactic lectures are liked by anybody. What type of lectures you like them? Some of the volunteers can say, you don't like the routine lectures, right? And what else you like? Simulation? Yes, because participatory learning is the first focus of students nowadays. So to participate, you have to do a training, simulation training. Simulation is what? Near to the reality, isn't it? Near to the reality, you are thrown in a place where you're taught and you're allowed to practice more and more times. So the patient are safe. Yes? Why ultimately, what is the reason that it is not you safe? Whom you are carrying, that patient will be safe when you practice on and on before going to the field, isn't it? So you will learn the principles of procedures, you will learn how to do the real way of doing the procedures. You may do mistakes on the mannequins. You cannot do mistakes on the patients, right? Patients are the care seekers. We have to give them ultimate care, quality care, cost effective care. People talk on health economics. You can't waste the money of the government. You can't waste the money of the patient. So we have to be more conscious and cautious about the money spent invested on the patient care. So you can't do mistakes, correct, redo the surgery. This, no way. Nobody now tolerant for any mistakes. So to prevent mistakes, simulations are the safest area where the nurses can be confidently, competently trained, and then now you are ready for the procedures to do it on the patient. That confidence level, the simulation training is being given, isn't it? So these are the changes now happening and focus on different area of the specialty. Talking about the train ambulance, yes, talking about the train ambulance, heli ambulance, heard of it? Skill set is same, training is same, but the area where you're doing is different. With the limited resources, emergent need to do. So you should have adrenaline rush and you have to be trained for that. So now the growing field is more in nursing. Not the same thing. After you study nursing, you go to some hospital, do that, then come back after shift. No. The nurses are there in the policymakers as policymakers. So this is all different area of extensive nursing services are there. Different areas of nursing services available. Now you tell me, is that the same way of pattern of nursing education to be remaining same? Yes. After tea only I will tell, ma'am. Huh? Yes. You are getting my question? To fulfill the extended service, to fulfill the different speciality of nursing services, the prevalent or the backward nursing education will be sufficing to the changes, will be enough for the changes. No, so there need to be a change in nursing education and then the change in nursing services. Nursing services now elaborately expanded. See how I'm telling, elaborately expanded. telenursing, telephonic nursing, what digitally available, every type of nursing is available now. Space nursing, everything is available. Are we competent to fulfill the areas of those services? Not enough. Not enough. What we studying is also not enough. What we train you also not enough. Much more we need it. So that is the thought which is taken by by Dr. Ajita and the team and the organizers of this Gorakhnath College has put up this international conference to put a theme on future of nursing education and services. I thank Dr. Ajita and the team where this thought critically taken and they are fulfilling the themes like this, right? So the take home message for this future of nursing education and services from me, I'm telling, we have been elaboratedly expanded our nursing services. It is now the institutions running the nursing college to take up how speedy and how competently you are training the students. That INC also taken care of, and institutions and university also taking care of. So with that, students should aspire and learn adequately to compete with the global standards. I wish you all the best. Thank you so much.
Thank you, ma'am. We updated our knowledge with innovative ideas, and it's helpful for students as well as for us regarding the future of nursing services and education. Thank you, ma'am. I am indeed happy to introduce Dr. Devika ma'am, Assistant Professor, AIMS College of Nursing, Gorakhpur, Uttar Pradesh. She has completed her undergraduate in the year of 2006, PG in 2010, and doctorate in 2018. She has published articles more than 35. Ma'am has received the Best Paper Presenter and Poster Presentation Award, and she recognized fellowship of the Academy for Clinical Emergency Nursing in India. Ma'am is an editorial member, team member of TNI. Ma'am is having 14 years of experience in teaching and research work. Now, I would like to invite co-chairperson Dr. Devika ma'am for the invited talk on future of nursing services. Welcome you, ma'am.
Thank you. Esteemed guests, honorable dignitaries of the dais, and participants, of course, students, good afternoon or good evening to one and all gathered here. Before me, Madam Madam given an insightful speech on future of nursing education. So let us talk on future of nursing service. So nursing service means the care provided in the hospital, where the nurses are showing what are the innovations, what is the future we are expecting. Some of the key highlights I'm going to discuss on this matter of future of nursing service. So now, yes, nurses will continue to be in high in demand. Yes or no? So nursing is a global profession now. So after completing your 4 years course, no need to sit at home, no need to wait for the job opportunity. So if you open the newspaper, if you can find out your job where you want and what type of job you want. Yes. So it's highly demanding profession. So it is about a global profession. If you want to fly for abroad, immediately you can take a decision and you can go for it. Yes. So this is one future. This is present also we are growing, and in future also, the demand will increase. And according to the U.S. Uh, statistics says 12 percentage there will be increment in the job opportunity for the nurses in near future. That means 2028. So it shows that nurses always in demanding. The next one is more male nurse will enter into the nursing field. I can see some male nursing students. We have male nursing students, ma'am. So, okay, sorry. Okay, anyway, so male nurses will enter in the nursing field in near future because now Sigma is eliminated regarding nurse. Now, males understand that the great opportunity of the nursing profession and employment and satisfaction behind this job, and yes, of course, good salary. Yes, so we can expect the more male nurses entering into the nursing field. Third highlight is nurse practitioners. So now independent nurse practitioners. It is now it's a present scenario. The INC is introduced this nurse practitioners course. Yes, Ministry of Health and Family Welfare also announced to start the nurse practitioners course in all the government hospitals. So with this, we can have, expand the scope of practice. Okay. So the independent nurse, we have as individual roles, and wherever the medical facilities are less, wherever the doctors are less in numbers, we can act in there. The next one is increase nurse-led care clinic. Do you know nurse-led care clinic is run by nurses only? So AIMS Bhopal recently inaugurated this nurse-led care clinic. So this clinic only run by the nurses, referred by the doctors, and the counseling, screening, everything will be done by only a nurses. So this is a new scope for us. Okay. So we can get that opportunity to run and work in the nurse-led care clinic. Next one is more nurses will choose to specialize. So what is specialized things? Where we can move on to it. When you get into the job, you come to know what are the specializations are there and how we can motivate ourselves and how we can go about it. For example, in short-term course, certificate course programs are available for neonate and for ICU nurse and for quality control and for infection control nurse. So these are some of the certificate programs, and after entering into the job, you will try to expand it because future employers will recruit this type of specialized nurses for fulfilling their quality services. And next is interprofessional collaboration. Yes, we can expect inter collaborations. Now it is present, and in future it will be more in number. So, what is interprofessional collaboration? So, collaboration with the doctors and other professionals, we will work for the teamwork. Especially in case of emergency, we can't do it individually all the works. And to save the life of the patients, we need a teamwork and good communication. So, this is only possible with one interprofessional collaboration. So we can expect more expansion of this interprofessional collaboration. And next is all nurses will think of pursuing higher degrees. Yes, after BSc, what is the next step? What is a higher degree for the BSc? MSc. After completing MSc, PhD program. After completing PhD, post PhD. So, like this, we will try to expand ourselves because if you want an advanced position and if you want to expand your scope of practice, it is necessary to go for the higher degree. So, all nurses will think of in future, all nurses will think of higher degree to pursue higher degree. And next one is more nurses will enroll in online program. So why there is a online program is necessary in order to update the knowledge and practice, the skill. Okay, to update our knowledge and skill, we need continuous education. So for that, in future, all nurses will go for this online programs. Next is nurses will be technologically sound enough. Maybe in near future, who knows, artificial intelligence will be recruited. Only will be recruited. Okay, so because technologically sound enough nurses are required for the future of India, because everything now is digital. So AI is placing a new dimension in changing the role of all healthcare professionals. And next is nurse will be an health and wellness centers. You can expect even in community health centers, even in community setup, we are heard about a health and wellness center. Government has introduced this health and wellness centers for comprehensive primary health care. In these centers also we will get the job as a mid-level health practitioner. So this is the new area we have to work in the community level. So these are some of the highlights which shows that nursing future of nursing looks bright. So with new technology, teamwork and focus on patient and nurse will make the healthcare better for everyone. Let's excited for the future of nursing and all the good it will bring. Thank you everyone. Thank you once again for your commitment to the future of nursing. May we continue the journey forward together, guided by the light of compassion, courage and hope. Thank you one and all. I would like to thank my sincere thanks to organizing committee people at the College of Nursing, Gorakhnath University for granting me this opportunity. Thank you. Thank you.
Thank you, ma'am. Shared your ideas regarding future of nursing services in India. Now, we taking this time to express my gratitude to appreciate the speakers in this session who has given the valuable and meaningful presentation for us from the topic of future of nursing services and education as a token for appreciation. Now, I invite Colonel Dr. Rajesh Begal sir, Director, Guru Shri Gorakshnath Institute of Medical Science, to honor the Dr. Renuka ma'am, Principal, and Dr. Devika ma'am, Assistant Professor from AIMS College of Nursing, Gorakhpur. Thank you, ma'am. Thank you, sir. Every beginning has an end. So we have come to the end of the session. It's about how competent and the skilled nurses can take on nowadays new days of working to enable them to perform in a wide range of settings with many different colleagues and teams while retaining a central focus on personalized, compassionate, right-based care. Going forward, a special focus has to be laid on upskilling the nurses and preparing them for more challenging roles, handling crises and emergencies, and progressing in their career path. Let us never consider ourselves to finished nurses. We must be learning all our limbs. Let us never consider ourselves To finish the nurses, we must be learning all our lives, given by Florence Nightingale. Today, we have to take one more promise to this session. I attribute my success to this. I never gave any excuses. I attribute my success to this. I never gave any excuses. Now, I am going to close my session. I would like to thank Chairperson Dr. Renuka Ma'am, Principal, and Co-Chairperson Dr. Devika Ma'am, Assistant Professor from AIMS College of Nursing, and Dr. Alka Saxena Ma'am, Principal of BRD Nursing College, and Colonel Dr. Rajesh Begal Sir, Director, Guru Shri Gorakhnath Institute of Medical Science, and beloved Principal Dr. D.S. Ajita Ma'am, for giving this one good opportunity to in this conference throughout the session. Thank you, ma'am. I thank everyone for your kind cooperation to complete this session successfully. Thank you, one and all. Now, I request all the delegates to stand up for the national anthem.
Attention, please. Let's start. जनगण अधिनायक पंजाब सिंध गुजरात विंध्य हिमाचल ऊसर जलधि तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय जय गण मंगलदाय भारत भाग्य विधाता जय हे जय हे जय हे जय 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 भारत माता की भारत माता की वंदे. Thank you all. Now everyone can go for tea break. I request all the dignitaries to be in the guest hall for the tea break.